Lightning Talk Assignment by Catherine LaGrange. From Module 5, I am interested in religion and medical decisions. I found that it is very interesting to learn about how different religions can influence people's medical decisions, from beginning of life decisions to end of life decisions, and everything in between. This can include things like the use of birth control, abortion, whether to use treatments that prolong life at the end, transfusions, and many other things. Some religions don't allow any healthcare services due to their belief that health is in God's hands. This made me ask the questions, how much is allowed or legal for religions to make decisions on in regard to medical treatment? Also, what are the regulations on minors not getting the care they need due to religious beliefs? I wondered if it was completely up to the patients and loved ones to make whatever decisions, regardless of whether they need it or not. Because, in a situation where the patient is dying and they can get treatment that will help them, but it is against their religious beliefs, will doctors and healthcare workers just back off and let the patient possibly die? Perhaps healthcare workers do respect the patient's decisions and plan accordingly to what they are okay with in regard to their religion. I also wonder what regulations, if there are any, on minors not getting the care they need due to their patients' religious beliefs. Because the parents are in charge of making decisions for their children, but to what extent? Perhaps it is still completely up to the parents, regardless of the patient's outcome. Or maybe it depends on the situation and how serious the patient's condition is. After reviewing the literature, I found that in the United States, adults can refuse any medical treatment or care as long as they are competent to make their own decisions. And in the situation that the patient is not able to make their own decisions, their surrogate or advance directive is to make the medical decisions for them. For minors, the religious decisions made about medical treatment is very complicated. Decisions made for regular elective measures like checkups, vaccines, medications, etc. is up to the parent's religion and what they believe in. Decisions made for life-threatening situations can be taken to court and taken into consideration legally. If the parents are not present during the critical treatment, then the doctors will then follow basic protocol to help the patient. Still, any case can be taken to court if child medical neglect is taking place, but it is up to the court at that point. Works cited.